Hello, good morning. Thank you everyone for joining us. It is me here again. I'm Dr. Bolanle Akinronbi, psychiatrist and founder at Bright Minds MD, a psychiatry practice in New Jersey and New York, where we help people with depression and anxiety disorders feel better with fewer medications and wellness practices. With me today, I have Dr. Shade Farri. She is the breath doc and founder, CLAPS MD, serving New Jersey. Today will be, and welcome, Dr. Shade, welcome.
Thank you.
Today, our topic, or what we'll be talking about, is the intersection of asthma and anxiety. As a psychiatrist, right, I get people who sometimes show up to me after they've rushed to the hospital. Maybe they have asthma or maybe they have anxiety. Anyway, I know that people with either of these think one is the other, and they show up at the ER a lot, or not as often as they learn to manage this and trying to figure out what's what. So I thought it'd be interesting if I spoke with a breath doc. A pulmonologist really is the formal name, but breath doc is so much cooler, and it tells us exactly what she does. She's a breath and lung specialist, and so that's what we'll be talking about today. Can I give a moment to Dr. Farri to introduce herself? My apologies.
Hi, everyone. Thank you, Dr. Akinronbi, for having me. I'm Dr. Shadi Farri, like you said, and the medical director and founder of Children's Lung Asthma and Pulmonary Specialist, CLAPS MD, and the Breath Doc. So, absolutely. So it's a pleasure to be here. I love what we do at CLAPS MD is we help children with chronic breathing problems breathe and thrive better. And so talking about this interesting topic that we're doing today is something that I think not just children, but everyone can learn from. So it's interesting, and I'm happy to be here.
Absolutely. Thank you so very much. So anxiety is under the umbrella, right? When we parcel out the body into specializations, anxiety is technically like a psychiatric, a psychiatric symptom, a psychiatric disorder. And then at its max in a panic, it shows up as, internally first, you have the worried mind, you have the restless brain, and then it translates physically into restless body, increasing, breathing fast, heart pounding, tremors, sweating, and all that. And some of these things are things that also show up for asthma, right? And so sometimes it gets unclear for patients, or patients don't know what to do when these things happen. So can you tell us a bit about asthma and anxiety in your experience? What you see on your end, as a breath doctor, when you're seeing patients presenting and trying to tease out, is this asthma or is this anxiety?
Oh, thank you. Yes, like we mentioned earlier on, shortness of breath, and just like Dr. Kirubi rightly said, now the fact that shortness of breath is a very common symptom with asthma. So in asthma, simply put, asthma is the chronic or repetitive cycle of trouble breathing because there's narrowing of the breathing pipes in the lungs. And so, one of the things that happens, because the lungs help us to breathe, is that to compensate for that obstruction, one of the things, it gets harder to breathe, we breathe faster. And so, but like you said, the intersection is that with anxiety, even though the origin is different, at some point, because of the restless body, you start to have trouble breathing, and to compensate, you breathe faster as well. So we could see how in one, the genesis is inside the lungs, is mechanical, so to speak, and the other one, even though it's not from the lungs, you end up with the same thing. So commonly, one first thing will be that both types of patients can have trouble breathing. I think the first thing to do is to pay attention to what was happening, or what was the setting, what are the surrounding symptoms. Commonly in asthma, you'll hear somebody had viral illness, they were exercising, they were exposed to some type of allergen or smoke. So that tends to be the surrounding event. On the other hand, with anxiety, it might be some type of stressful situation, some type of emotional disruption, or something that they find distressing was happening or had happened. And so the setting, many times don't overlap. So we can pay attention to that. I Stop me if I'm talking too long.
No, that's okay. You're doing great. I'm learning too. I'm thinking
No
about
problem.
this.
So we can pay attention to the triggers. The other thing is what else? What other symptoms? So knowing because we have so many systems in our body tends to manifest symptoms together in collection. So even before the physician asks you, as a patient, you could check and look and say what else is going on. Commonly with asthma, there'll be other respiratory symptoms. There'll be cough. It might precede the shortness of breath. There'll be chest tightness, a physical feeling that, oh, it's hard to really take a breath in and out without some trouble. There might be wheezing. So those will go with asthma. On the other hand, however, with anxiety, they might have the pacing heart, the palpitations, the sweatiness. But many times there's no cough, there's no wheeze, there's no overlapping respiratory additional respiratory symptoms with the shortness of breath. So that's another thing. Another one will be the duration or the progression of symptoms. Okay. With asthma, it will tend to progress. So many times with the respiratory illness, they might have had a cold for the last few days, and then now slowly, it's getting harder to breathe, or chest tightness or wheezing, and now at this point, there's shortness of breath. On the other hand, with anxiety, it will tend to be sudden onset, very acute, very situational, and within however long it lasts, a few minutes, 20 minutes, there might be many episodes in a day, but 15 minutes at the end of that particular episode, there's nothing else. There's no other symptoms. So while the other one, asthma will tend to progressively build up and will hardly also be gone within a short period of time. It will take, even when it starts to improve, it will take time to get better. But with anxiety, it will not. The other is response to medications, right? At some point, especially the first time it happens, it might be confusing in anyone. But with asthma symptoms, they will respond. So like you said, the patient who may have gone to the emergency room or has mentioned it to their doctor or has been seen different specialists, they might have tried. For asthma, they will try the short relief asthma medications. And but one of the things that they might, at the point when they're seeing you or me or someone else, they might say, oh, but it's not getting better with, the asthma medications that they gave me if we thought it was asthma and someone gave you. So that's another thing that will help. And I will stop there, but I for now, but I think that commonly, even at home, especially if this has been a cycle, anyone can begin to look at what are the triggers, what's the progression, what else is happening when this happens, and what has helped and what is not helping.
Thank you for recapping it. Actually, that's what I was trying to make sure I remember the highlights of that as well, is that to tell both apart, it's what's a trigger, so what's the circumstance, what's happening when this is happening, how long is it going on for, like the duration, like you mentioned. And I think the third thing, so yeah, circumstance, duration, and the third point,
the progression.
The progression. So how is it progressing? So those were the three major points. And I was going to segue actually into, so some people will have both, right? And we and I were starting to talk about that, because some of my patients who have asthma, when one is happening, say they're having trouble breathing, and maybe they have an anxiety disorder too, right? That's a tough point. And you had started to talk about what to do. And I thought you really hit the nail on the head with the response to medication. So I would say, like, if you're someone who has asthma, you're having trouble breathing, because sometimes anxiety, people don't know what their trigger is, and they don't know, because sometimes it's triggered by thoughts that they're not even aware of. Right. So they're like, I'm just out here. Maybe I'm taking a walk. It's out in the cold. And I just started, having trouble catching my breath. Was I anxious? I don't know. I wasn't really thinking about anything, or I'm not aware of what I was thinking of, but I also have asthma, and I was also in this cold air, right? I'm bringing a little of exercise anxiety in there to make it more complex. But I think it's really pointed that you say at least try, if you know that you already have asthma, it would be helpful to check for response to medications, because the one that maybe more immediately life-threatening is the asthma, right? I would think so. So yeah. I would probably recommend to my patients, say, if this is happening, use your asthma medication in the moment. and see what pops out. If you get your relief, then we know it was just asthma. However, what complicates things is that when people start to struggle for breath, even if it were an anxiety attack, there's a sense of dread when you cannot catch your breath, especially if you don't have your inhaler right there and then. And then that triggers an anxiety attack. And so both is happening both are happening at the same time, and that feels very, very dreadful. And you've talked about using like the medicines that they have available, but I'm wondering, are there other things we can recommend to patients like that?
So you describe it perfect, right? Where then it becomes, is it this? And then because one will make asthma, will poorly controlled asthma, like you rightly described, will make your anxiety worse if things are not getting better. So I think that the first step is that because asthma is chronic, and that term just means it tends, there will be acute episodes, like you described, nice day, taking a walk, but it's cool. It will not happen just once. So in the first time it happens, it will appear to everyone as potentially, dangerous, life-threatening, get immediate, and everything we're saying here doesn't equate to
medical advice.
Medical
advice. Get your own doctor. This is just education.
So that's important. So at first, when you don't know what's happening, it's right to seek immediate medical help, whatever setting that is, get it checked out. But for the kind of patient who already knows they have asthma, who already has access to the short relief medications, the first next step is to first use it, right? Use it as instructed by your doctor before that. Now, if you then notice, so this is where that the response, especially if you have asthma, you would have known what response feels like. So in the amount of time you should. So the response is not adequate already. If that person also knows that they have anxiety, then they might have to, and that's why your expertise leans in. They might have to take a step back and say, even if I wasn't aware, or is this anxiety? So I've done what I should for asthma. I haven't gotten the response in the time. We also have a number of tries. So that's one thing, is that if you already have the diagnosis of anxiety, after you've taken treatment for asthma and you don't get a response, you may want to lean into that. Or is this anxiety? The next thing will be that for asthma, again, if you're already diagnosed, you would have controller medications. These will be medications that usually help to reduce the severity and the number of times you have episodes, those acute exacerbations or acute worsening.
The maintenance meds, right?
Maintenance meds, yes.
Okay.
So if you were supposed to be taking maintenance meds, have you been taking them? Because what would happen is that if you're off your maintenance meds, then the acute episodes can be as bad as we're describing, which is out of nowhere. So that's the second thing. If you've not been taking your maintenance meds, this may be an acute episode that will be worse and harder to sort of get under control. So that's the next thing. And then I think the third thing that's quite important is that if you are feeling like that cycle where now it's really, really hard to breathe, all right, because I can't, and I'm getting anxious. With asthma, because it's life-threatening, if we don't respond immediately, I would always recommend that if you've done the maximum number of tries of short relief medicine and you still don't feel better and you can't tell the difference, seek immediate medical help. But when you then go in, we can make sure, your oxygen levels, all the things we do to make sure that we stabilize breathing, right? And then we can have that conversation about anxiety on the other end. So I think it's take your short-acting asthma medicine if you have the diagnosis. If you don't have the diagnosis, like we said at the beginning, seek immediate medical help. But then when we go into the office, be willing to sort of take a step back and look at this, because we'll talk about the denial of both, right, in a minute. I think that's another thing, because
yeah, let's get into that actually, because sometimes like part of it is people either don't want to have asthma, or more often they don't want to have anxiety. And so how does that show up for you in practice? But I like to touch on the highlights real quick though. But what the point I'm taking from what you just said is that to emphasize to my patients with anxiety who also have asthma to take their maintenance asthma meds,
Yes.
and to always have their rescue medicines available, so that they can at least eliminate the more immediately life-threatening thing when they're feeling super anxious. And that overall reduces probably the likelihood that they're going to have anxiety attacks as frequently, or well, as anxiety attacks that I induce at least by asthma, that will reduce the likelihood of that, and keep them steady and well maintained later. Denial, let's talk about that real quick. What's that showing? How's that showing up for you, like, with your patients?
So it will be that many times the teenage patient, right? Who maybe as younger toddlers they had episodes of wheezing, but then it was never met the threshold that this is asthma, and so they might have had respiratory symptoms in the past, but it all went away. They many times have not carried the diagnosis of asthma or not gone for a formal evaluation. So they may have asthma, but they've never been diagnosed. But now then their teenage years, or they're in school one day, they have episodes, and that ends up going to the emergency room, or the cycles of episodes, and now they're presenting with symptoms that they've come to the lung specialist, and they want us to tell them that this is asthma, or that's what everyone, the school nurse, the mom, the neighbor, that's what everyone has called it. Okay. And then we ask them some of the clarifying questions we talked about in the beginning. What else is happening? And then as they tell the story and just repeated episodes, there's no associated breathing problems, right? The settings, it's happening in school. Now you talk about school grades, how school, they've experienced some bullying, they've experienced some
social stressors.
Social stressors quickly come up in the tail, and you're taking family history, and there's the example, there's stories where the one spouse, there's recent divorce,
separations,
and so all of that history taking that we're doing, and then it quickly becomes obvious to me or to the clinician that, okay, even though everybody has labeled this as asthma, even though they brought them from the asthma room and every test, that this is not. So, and then many times, the first time we do additional testing, right? There's all the things we do, but I start to prep them and tell them that there's a potential. I'm going to make sure your lungs are okay. We're going to get additional testing. I prep them that sometimes we find out that it's not from the lungs. And so what I do is that slow, gentle nudging, and then many times when they come back and I have all the results back, I tell them, I make them realize that, there's our body and mind connection, right? And then I say sometimes our body is manifesting is from the mind. So I try not to play any psychiatrist.
Is this when you tell them go see a psychiatrist?
Yes.
And I almost hear you saying, are people receptive to that, or are they like, no, it has to be asthma, make it asthma?
Oh yeah, I get that a lot. But again, like we do, I encourage them, and I tell them about how, to the parent and to the child, sometimes I have to separate them. And so to do that, because the counseling, I encourage leaning to what's available in school. I bring it up. I tell them I speak to your pediatrician. I encourage them, or to your primary doctor. I encourage them to we've done some tests. We've done sometimes trial of medications, right, to prove to them, and the symptoms are the same. And I encourage them. There's so much improvement that can be made if you get treatment. So so
that's really important. So it's not always asthma. Like after the workup is done and it's been looked at and it's clear that there's a mind-body connection here, the solution then would be to talk to a psychiatrist or primary care, at least, to begin that conversation and see if addressing the stressor, whether through SSRIs if you're using medicines, or even begin with talk therapy, right? Counseling, talk therapy to address the ongoing stressor might be the answer to the breathing problem. That's not asthma. That's really, really, really important, because, and I'm always just fascinated by how we forget often that our body is just one body, and what's happening somewhere shows up elsewhere, and how sometimes our patients get have to go back and forth to figure out who's the right kind of doctor to be addressing this breathing problem for me, right? If you're having a breathing problem, you think, yeah, sure, it should be the breathing doc, but sometimes your answer is in the mind body doc, the psychiatrist, the therapist, to help address the situation that is really causing that problem. So I think that's really really important to highlight. And one last thing to bring up is, do people develop asthma later in life? Does it show up later in life for people? Like, I
Yes.
deal more with adults, and sometimes, I wonder what your thoughts are about that.
Oh, absolutely, yes. So sometimes asthma worsens based on exposures, based on, so they might have had mild disease. So asthma tends to be, there's many allergies can tie in. So they might have had milder disease earlier in life. The other thing is that COPD, which is not asthma, but presents as trouble breathing, very similar to asthma, and there's many overlaps. May develop, especially people who have smoked, people who have had exposures to biomass fuels, and some types of environmental exposures. So it may be COPD, which tends to come up always later in life, doesn't happen in childhood. But it also could be asthma that has worsened over time, also because of poor management. So when you don't manage asthma well, lung function worsens and we can't get it back. So they may have had mild asthma in early childhood that they could get by without maintenance meds. But now as they age, they've lost some lung function that they can get back. So now they really need treatment until it will develop. So even though it's less common that way, but asthma can be discovered later on in life.
Interesting. Thank you. And good point also on that COPD. I'm remembering now that I've also had some COPD anxiety combos as well, because again, not being able to breathe is such an anxiety provoking experience. So like I do see them co-occur as well together. Okay, thank you so very much. It's been a fun conversation, an interesting conversation. I'm taking something away from it for my patients, and I hope that anyone who's watching right now or watching later will also take something from it. And I'm asking anyone who listens now or later to leave us a comment or a question if you find something interesting or something you'd like us to explore a little more, maybe at a later date with Dr. Farri, just on this topic as well. Dr. Farri, any just two things I'm going to ask you. One is, do you have any final thoughts for today for the people listening? And also, where can people find you?
Sure. I think that this topic is interesting. The more I talk about it now, the more I remember how, so all the things that we brought up as remembering that the body and the mind are connected. Remembering that even though what you see is a symptom, it may come from different systems. So don't be rigid about this has to be asthma. Yeah, this, right? At the same time, if it is anxiety, if it's something from the mind, it's better to talk to the expert. It's better to go see, Dr. Akinronbi, go to Bright Mind Psychiatry and checked out, right? Because it doesn't, what we want is that you're feeling better. Is that right? That's
the end goal.
If we find out whatever the cause is, accept that, embrace that, get the treatment you need, and we want you to thrive. So absolutely. Where can you find me? So CLAPS MD is opening soon. I think we're counting down 6 weeks. We'll be in Wayne, New Jersey. Yay!
Yay!
So I'm at Instagram. That will be our primary page, Sade.Farri. That's my handle. We're also going to, it will be Child Long Doc on YouTube. We should launch our channel soon. Awesome. But for now, Instagram is our is where we are. Sade, my name, SHADE.FARRI. That's our handle, and we'll go from there. But look out for us on social media. We'll be in, if you're in Northern New Jersey and your child, someone, a family member, is some type of chronic respiratory problems, give us a look up. So you can get on our wait list.
Thank you so much for your time, Dr. Farri. Thank you so very much. I think we'll probably do an encore and talk about this one more time a little bit. It just gets interesting the more you start to make the mind-body connection in terms of human experiences. But thank you so much for your time. Again, I'm Dr. Bolanle Akinronbi, psychiatrist and founder of Bright Minds MD, a psychiatric practice where we help people feel better using fewer medications and wellness practices. We serve virtually, and we can be found online at BRIGHTMINDSMD.com, brightmindsmd.com. We see people all over New Jersey and New York virtually. Thank you again for listening. Have a wonderful day.